This conference will now be recorded.
Well, good Tuesday morning to everyone, and thank you for joining us on the Nacogdoches Chamber Stakeholders Conference call sponsored by Burke. We are recording this call for later posting on the Chamber's YouTube channel, and we've invited our media friends to join us. I'm Kelly Augustine, a staff member of the Nacogdoches County Chamber, and I'm temporarily stepping in for our president, Mr. Mitchell, but Wayne Mitchell happens to be on the call today. So we are thrilled to have him, and I'm sure he may have some parting words for us at the end of the call. So we'll look forward to that. Today's chamber call begins with a special presentation by Anita Humphreys, Chief Operating Officer of East Texas Community Health Services. Ms. Humphreys is ETCHS's longest tenured employee, having joined the clinic in the mid-1990s as a temp accountant. But it wasn't long after that she was hired full-time as Chief Financial Officer, where she worked to stabilize the organization's fiscal position and earned unqualified financial audits every year since her hiring. I think that means she kept up with the money really well. She transitioned to the role of CEO in the fall of 2018. Originally from Houston area, Ms. Humphreys moved to Nacogdoches to attend Stephen F. Austin State University. She has been very active in the local community, teaching both Sunday school and vacation Bible school, serving as an adult leader for the local 4-H and as a commissioner for the Nacogdoches Summer Baseball Program. She currently serves on several local boards and on advocacy and membership committees with the Texas Association of Community Health Centers. During her tenure as CFO and continuing as CEO, Ms. Humphreys has worked to increase operational capacity and expansion to service access through controlled growth. With the acquisition of additional grants and long-term state contracts, in addition to telehealth and mobile capabilities, ETCHS currently operates 5 static locations, 3 in Nacogdoches and 2 in Angelina counties. Employees over 100 full-time staff and served over 10,000 patients during 2020. Good morning, Anita. We welcome you to the Nacogdoches County Chamber's conference call.
Good morning. Thank you, Kelly. I appreciate the opportunity to talk to everybody today. While most of you are very familiar with East Texas Community Health, I know there are some new members that may not be aware of who we are and what we are. So I'm going to take a few minutes to talk about that, and then we'll spend the second half of my time to discuss the elephant in the room, the COVID-19 pandemic, testing and vaccination resources, and where we may be headed from there. So just briefly, East Texas Community Health was organized and started by a group of concerned citizens in 1987 to address the ever-increasing need for primary care to those in the underserved areas, the low income, the folks without insurance. And so they saw a need in our rural area to address that. And so they joined together and formed East Texas Community Health Services, applied for federal funding, were significant in receiving that because there weren't a lot of people getting those back in that day. And that's kind of where it went from there. We've been growing ever since. There's a couple of things that are unique about our organization that most people don't realize. One, we are a 501c3 nonprofit organization. We are primarily funded with state and federal grants, but we are not a governmental agency. We are a standalone corporation. Secondly, as a recipient of federal funds, we have a board of directors that is 100% volunteer. And the uniqueness about that board is that 51% of the seats on that board must be current users of our facility. In other words, they have to be patients of our sites. So basically, we do truly work for our customers. They make all of the policy decisions. They set our hours. They do strategic planning on where we should be going and what we should be doing. and they are involved in all of the higher level decisions that the company makes. So that has been that's also a unique challenge. But the other 49% of the board members are members such as you. We try to draw from the community to fill different expertise levels so that we can keep that education level on the board and that cross coverage for knowledge, so that when we are working on strategic planning, we've got input from not only our patients, but the educational sector, governmental sector, fiscal sector, so that we can make some really, hopefully, smart long-term planning. The second thing is we continue to be patient-focused. We are a patient-centered medical home. We are registered and certified with at the federal level for that, which means that we provide team-based care. When people enter our site, they are not just a patient or a dental patient or a mental health patient. They have access to all of our services. So we don't. There's no discrimination on who can see us. While we are primarily funded for the low income and the underinsured, we see everybody. People are surprised sometimes, particularly the Medicare population. We can discount their co-pays a lot of times. So that 20% that's out of pocket for a Medicare patient, a lot of times for us, depending on their income level, which for a lot of our seniors is very fixed and very low, we can discount that out-of-pocket expense for them. We also carry our own in-house Class D pharmacy, so we can fill a lot of prescriptions for a lot of people on the generic level and keep that cost down for them as well. So we have a lot to offer, and we kind of think of ourselves as one of the best kept secrets in Nacogdoches and Angelina County right now. Our service area is defined as Nacogdoches and the surrounding counties. So that includes Cherokee, Sabine, St. Augustine, Angelina, and Shelby. We see patients from everywhere, as far south as Polk County, as far west as Houston County, and we've even had people come in from Louisiana, being as close to the border as we are. So we don't discourage or create a barrier for them. They're all welcome to come. As Kelly said, we have about 100 employees. 15 of those are our providers. We have 3 full-time dentists. We have 1.5 hygienists, medical providers, and licensed professional counselors on staff. So we're really well-rounded in the services that we can provide. The other thing that's unique about our services is that we give discounted sliding fee to our patients. So just to put that in perspective, that under today's current federal poverty levels, a family of 4 whose gross income for the year is at or below $52,400 would receive some level of discount for us. Their out-of-pocket copay for medical coverage would be at $40 or less, depending on where they fell on the scale. Their dental services would be at $100 or less for out-of-pocket costs, regardless of what services we provided, unless the cost of those services was less than $100. So in other words, it would never be more than the total charges, but it will cap at $100. Their pharmacy scripts per fill would be $9 and no more. And any radiology that we could provide for them would be $25 out-of-pocket costs. So we are very user-friendly, I like to say. We try to be cognizant of people's limited incomes and make the best choices we can for what resources we have available to them. So having said all of those things, we operate, as Kelly also said, we operate 3 sites in Nacogdoches. We have our primary medical site on University Drive. We have our dental site off of Douglas Highway over near the jail. It's up, I guess, a little bit to the, I guess that's the east, maybe west of Lone Star Feed. And then we also have a site that we run in conjunction with the local Burke Center. We run a facility inside their facility 2 days a week, and that is open to Burke patients and their families as well. In Angelina County, we just recently opened a 9,000 square foot facility on Sayers which is in North Lufkin. And then we have a smaller site on Shands Drive, which is real close to all of the medical facilities, the hospital over there. So we are well-rounded. We have a lot of access. In addition to that, we also have a mobile unit that we are going to be putting back into service. We took it out of service for a few years because it was really not well received in the community, and we couldn't really find a place. We just couldn't find a home for it. But now with the COVID pandemic and the opportunity to do some rural outreach education and take the vaccines to the people, we're going to be looking at some of those opportunities as well. So just to give you a little perspective of the population that we serve, and because all of you guys are businesses in and around our community, 63% of the patients that we serve come from Nacogdoches County. So they're by far the majority of the folks that we see live and work in our own hometown. 56% of those patients are non-Hispanic ethnicity. 41% of those register themselves as Hispanic, and the remaining 3 are varying between the Asian and non-reported. Our insurance status, about 61% of our patients have no insurance. That's actually low for the state of Texas, but I think it's high for what most of us think is going on in our community. People without insurance often go without care. They end up in the emergency room with critical needs, and particularly during the pandemic, they just didn't go anywhere, which has heightened not only their illnesses, but also the cost of treating those illnesses. So we do try to make sure that we're open. We stayed open during the pandemic. We kept our services all available. We did have to reduce our dental services, but for the most part, we kept access to our medical facilities all available to our patients. 54% of our patients make at or below 100% of poverty. To put that into some kind of financial perspective, a family of 4, that means that household makes less than $26,000 a year, which basically translates in terms that most people understand that they have a sole income producer that makes less than $12.50 an hour. That's a little hard to believe, but it is the reality of the world that we're living in right now. And that tends to heighten during times like this. So we are seeing an increase in those patients as well. But what I really want to talk to you guys about today is that we have been very fortunate in the last few months to be the recipient of several federal grants. And most recently, with the administration's release of the American Rescue Plan, we were given obviously not the entire $6 billion that was allocated, but we did receive a sizable award. And it is focused on vaccine capacity, increasing capacity within our area. It's focused on response and treatment to COVID, as well as maintaining and increasing capacity and rebuilding the infrastructure and the support and sustainability of not only our facilities, but of our communities as well. Gary Lee and I have had a couple of conversations because he happens to stay right down the hall from me most of the time when he decides to come to work. So about how to join some folks together to build that, to strengthen that, and to get some ideas on how we want to go forward with this. We're working with both the city and the county in not only Nacogdoches, but in Angelina County as well, to kind of pick up the ball once these large events are over with, to address COVID education awareness and the vaccine distribution. So while I think most of the counties and the cities have a pretty good handle on the large events and the big outreaches, those have been primarily done with volunteer organizations who, as most of us know, have real jobs. And over the course of time, they need to get back to those. And so that's kind of where we see us stepping in after that and utilizing a good portion of this funding to continue with doing those outreaches and those education opportunities and just distributing the vaccines themselves. Our plan right now is to pick up towards the end of the summer with establishing static COVID vaccine testing and vaccine sites so that as people become more comfortable with getting the shot, they will have a place that they can call and get an appointment Monday through Friday, Monday through Saturday. We're kind of fluid on that right now as to what our hours need to be. Do they need to be after hours? Do they need to be, early morning? What does the community want? And then make that available to folks. So, they're talking to their buddies. They decided, hey, I think I need to go get a shot. They can call up and get one, or they can just drive by and come in and get them. We are really wanting to make it something that the community can count on so that as testing needs happen, or as a vaccine opportunity needs to be met, we can be there to do that, and we don't have to wait for that Wednesday or that Saturday or whenever the next event is. Because as we all know, those have been wonderful, and they have done a marvelous job of getting the bulk of people that were on the immediate need crisis areas with shots. But those things, aren't sustainable over a long period of time. And so we really want to step in and work at this point, work more toward putting things into a more static routine so that folks know where they can go to get those shots. In addition to that, I really think right now it's going to be very important for businesses such as yourselves to reach out and join with us to try to get some good PR out there, some good PSAs created, some things where business leaders that the community recognize go on record in support of vaccinations, support of getting testing if they need to, support of getting us back to joining together, being together in what we hope to be a more normal pre-COVID arrangement. I'm not sure anybody really knows what that's going to look like yet, but we definitely want to keep working at it. And so one of the other areas that we're looking at, and Gary Lee and I talked about this pretty extensively yesterday, is looking at agencies not only within the chamber, but outside of the chamber, the nonprofit area, the education area, any place that there might be groups that can work with us to develop those outreaches, those PSAs, those presentations, anything that we can do to increase awareness of the real potential that the vaccination has for us, and not just what they're pulling off Facebook or what they got from a bad experience that was one time. There's all kinds of things going out there. I'm sure everybody's heard all of it, and it's lending itself to having some folks having non-confidence in the vaccines. We know that science is proving that that is not the case, and we really do need to get folks more comfortable with taking the shots. If you look back over history, we've done some great work in eradicating some horrible diseases simply by vaccinating. And that's the case with this one. We really need to push toward people being more comfortable with it. And that's where a lot of you guys can come in and help with that. We are going to be launching a media campaign. We will have funds to actually create some awareness within the community. In addition to that, if you're able to, to put your logo in that, to get your name out there, to get some support behind that, that's perfectly okay. We'll work together with you to do whatever we can do to get the community behind getting vaccinations. I really think that at this point, if anybody has any specific questions, I'll be happy to take those. I could talk about this all day long, but I know there's other things on the agenda, and I'm about 18 minutes in, so I'm going to stop right now if anyone has a specific question they'd like to ask.
Anita, this is Wayne Mitchell. Just a question about funding. Are you folks being adequately funded in order to react to all of these challenges that we're facing?
Yes, sir. Right now, we have been given a pretty sizable amount of federal dollars specifically targeted at vaccinations for the next 24 months. We feel like that the dollars we've been awarded is going to be adequate to serve our community and the communities that we have been designated to serve. Now, one of the things that we have seen a problem with is actually access to the vaccine. That seems to be working better now. And we are creating a pipeline for vaccines. One of the reasons that you saw the large outreaches in the beginning was because the vaccine was coming in large quantities, and then it would not be there for several days or weeks. And so now we're seeing that on a more steady basis. So we do have commitments from both counties, and a lot of all the hospitals, that they will be actually transferring vaccine to our sites, so that once we get the static locations set up, they will have the ability have the ability to get the vaccine when we need it. So yes.
And just one last question. How long does it take, and this may be a good question for Jessica as well, how long does it typically take from when one person registers for the vaccine list for them to get an appointment these days?
With our particular website, and I know there's several of them out there, and that's part of the confusion I think the public is having. So one of the things that we're working on is trying to unite that as well and consolidate that access point. But if a person is interested in getting a vaccine, if they will go to www.etchc.com, which is our website, there's a COVID vaccine button up in the upper left-hand corner of our site. If you click on that, it will send you to a registration screen, which is basically just a few basic questions. That puts you into our queue. I have dedicated call staff that will call you back. We are currently doing vaccinations every day. We try to bulk those, obviously, because of the way the vaccine has to be given. Once you puncture a vial of the Moderna, you've got 6 hours to get those 10 shots in an arm. So we do want to try to appoint those patients. But right now, we have availability every day within our own facility right now. So if someone wants a shot, they just need to call us and we'll get them scheduled for a shot. The other thing that we're looking at is mobilizing, putting our mobile unit in play. So if there are businesses that need us to come to them, that's something we can also do. So if you, as businesses in Nacogdoches, have a group of staff members that have agreed to get the vaccination and they need someone to come out and do that, give us a call. We have a dedicated team, and that's what they do. So, so please use and abuse us, as I'd like to say. So, thank you for the question.
Thank you.
Any other questions for Anita?
Hey, Anita, this is Anita.
Hey.
You talked about the mobile unit. What kind of space do you need in order to accommodate that?
It runs on a generator. It's totally self-contained. I just need a parking lot, a place where I can set it up and let it be there. It really, and if the mobile unit won't work, I'll just send my team with the cooler and we'll get it done. So, but the mobile unit, it's about the size of a small RV. So, putting it in a parking lot is really easy if we can have a little bit of dedicated space.
Great information. Anita, as we sign off, is there any other specific invitation you have for the businesses, employers in our area?
Well, I think if, as employers within the chamber or anyone else, because I know this is a awesome little network, but there's a lot of other networks that feed off of this. Any businesses that are interested in their employees accessing our services, needing vaccines, needing flu outreaches, and as we get into the fall, one of the other things we're looking at is kind of doing a child health jamboree fair this year to try to get kids back on track with their immunizations as well, because I know a lot of people kind of held off on that during the COVID. So we have a lot of kids that are behind on some of those shots. So we're really wanting to kind of mobilize everything that's available. And you guys can be great catalysts for that. You all run businesses that have a lot of traffic through them. So, being a place that would disseminate information on the clinic would be wonderful. I think if you guys could help us get the word out on what we do and how we do it, as well as the targeted areas that we're working on, One other thing that I did fail to mention, and again, Kelly, I can talk all day. We currently actually have a 3-year hypertension control project that we're doing. So patients of ours who register with hypertension, we're able to give them a self-monitoring device that they can have to take home to do their own blood pressure monitoring. It will upload to an app that will come into our site so that we can monitor those patients and help to get them under control. We would love to have people be more knowledgeable about that program. And if you know of someone who doesn't have a primary care provider and has that diagnosis, please send them our way.
Well, thank you for
Anita-
all the good information. It sounds like we have another question.
Yes, ma'am.
Yes, I'm sorry, Kelly, it's Donna. Anita, when you mentioned children, it sparked my memory. They're supposed to be launching that 12 and older vaccine ability. Will you be doing that at the clinic?
Yes, ma'am. Once the CDC releases those guidelines, we follow their lead. So once they have given us the okay to start with a different age group, we initiate that as soon as we have the availability of the vaccine. That's one of the reasons that we're trying to work with the school districts as much as we are right now, is in preparation of that. I did see something come across yesterday. I think they actually may have already released that.
I'll have to check. I don't know for sure, but thank you for the comment. I think I got what I needed from you via the.
I think, Dr. Head, you're on the call as well. I see. Did you get anything on that yesterday?
Maybe Dr. Head was called away.
Maybe so. Maybe so. That's fine. But
Well-
I did get something from the Bureau yesterday on that expansion to age 12. So.
Wonderful. And Anita, anytime you want to pass that information along to us, we can get out to our members as well.
Oh, I will definitely be reaching out to businesses as we move forward with this thing. So thank you very much for listening to me. I appreciate the time.
Well, we appreciate everything you and your team are doing. Thank you.
Thank you.
So moving along, we do have Dr. Scott Gordon, the president of Stephen F. Austin State University, on the agenda, but he may not have been able to join today. I'm going to give him a chance to jump in if he has. And while I'm giving him that chance, I just want to congratulate him and the entire university staff, all the way down to the student volunteers, for pulling off a successful accepted student event that was held on Saturday. The chamber was lucky enough to have a table there. I know Visit Nacogdoches had a table there. We talked to the most enthusiastic parents, family members, and students that are coming to SFA and to Nacogdoches. They all wanted more information on our community and what good things are going on here in Nacogdoches. So I'm thrilled that SFA allowed us to be there, and I'm thrilled that we have all these new folks coming into the university, and I'm sure we're all going to be welcoming them into our businesses as well. So I did see our city manager, Mario Canizares, on the call. How are you?
Good morning, Kelly. Hello, Wayne. I hope you're doing well. Good. Real quick report. We've got city council tonight. It's going to be a transition of elected officials. Shelley Brophy, Mayor Brophy, will start the meeting, and then we'll go through some of the ceremonial components of getting Jimmy Mize sworn in. There is a little bit of not an issue really, but just there's some certifications that needs to come from the county elections office. We have one vote that is an overseas ballot that needs to be received, and so if it's not received today, then we may need to administer the oath of office for Kathleen Bellinger, who won in the Northeast Ward. And if that's the case, then we'll do a special called meeting next week and get that squared away to allow her to start serving as city council. So we do have some transition going on later this afternoon. Overall, relatively short agenda. We've got our comprehensive annual financial report that we'll be covering to review the city's finances from the previous fiscal year. And then we'll be off to the races under the leadership of Mayor Mize. Otherwise, if you have any questions, that was my report.
Well, thank you for that. I don't see anybody popping in for questions, but I do see our President and CEO of Nacogdoches EDC is also on the call, Larissa Philpott, if you'd like to give an update.
Good morning, Kelly. Thank you, and good to see you, Wayne. Just one quick note or two quick notes. Just wanted to make sure that everyone is aware of the new Small Business Administration program, the Restaurant Revitalization Fund. These are tax-free federal grants. Essentially, these restaurants, and restaurant is what you imagine. It's a restaurant. It could be a bakery, could be a brewery, could be a distillery. They need just a small portion of their gross receipts to be from the sale of food. Essentially, if they can show a loss in 2020 versus what their gross receipts were in 2019, they can get a grant. They do have to take off the amount that they received in PPP loans and maybe local grants, but there should still be some money left over. So I highly encourage everybody to apply for that. If anybody's got questions, please let me know. And then also, we are super excited about our next Spanish entrepreneurship class. I am looking it up on my calendar to make sure I have the right date. May 25th at 6 p.m. at Sacred Heart Catholic Church. We are excited about that program. We're hopefully going to continue that throughout the summer. So if you know any Spanish-speaking business owners or allies of Spanish-speaking business owners, please encourage them to attend. Thank you very much.
Thank you, Larissa. Any questions for Larissa? Okay, well, looking forward to our report from Visit Nacogdoches from Ms. Sherry Chaney Morgan.
Good morning, Kelly, and good morning, friends. Great news. We all woke up this morning. That's the first thing. That's good news. We woke up and we already had two things going for us. We woke up in the great state of Texas, and we woke up in not only the oldest town in Texas, but arguably the greatest town in Texas. This week, the week of May 2nd through the 8th, is recognized as National Travel and Tourism Week. And in his proclamation yesterday, Governor Abbott recognized the tourism hospitality industry as the key economic driver leading the charge of economic recovery amid the pandemic. Little known fact, Texas ushered in the year 2021 as the 9th largest economy in the world based on gross domestic product. And almost halfway through the year 2021, some economists say that we're now at 7. 1 in 10 jobs in Texas falls under the category of the travel industry, totaling 1.3 million jobs here locally in Nacogdoches County. In 2020, that was a little over 1,000 jobs in travel and tourism. That's a lot for us. The theme for Travel and Tourism Week this year is the power of travel. And, you know, we don't want to focus on what we lost during the pandemic, but just to sort of drive home the point of how powerful tourism is for a community. In 2019, direct traveler spending in Nacogdoches County was $85.3 million. And in 2020, we saw a loss of $10 million. It was only $75.2 million. $10 million in our county, that's a lot of loss. But we're recovering, and we're going to get that back and then some. So we are so blessed in this community with new leadership. We're ushering in a new mayor and Mayor Mize. We've got a great new city manager and new superintendent, new university president. All of these leaders have joined together, and they agree that bringing back events is important. And yes, that is great. These events are great for the morale of our community, but our economic recovery and ability to thrive and grow and advance is dependent upon these events, specifically events that have a tourism draw. So how can you personally or professionally support tourism in our community? It might look like a financial sponsorship. It could be an in-kind donation of services. It could be volunteering. Mary Montniak just put in the chat section that Blueberry Festival needs volunteers. That's a great way to give back and support tourism. It might look like customer service training for your frontline staff, beautification of your storefronts, litter abatement. I challenge you today to really get creative and in your own ways, in your own wheelhouses, unleash the power of tourism in your segment of Nacogdoches and join together with Visit Nacogdoches to welcome back these visitors and tourists into our community. Just a reminder quickly, May 28th, Knack Snack Friday will be back, that fourth Friday event with food trucks. May 29th, already gone full moon summer concert series featuring, the already gone Eagles tribute band. Tickets are on sale now. You can do it online through Eventbrite, or we have hard tickets for sale at our front desk. June 11th, Blueberry Bluegrass concert in the park. June 12th, the Blueberry Festival, Cody Johnson as well. And then Restaurant Week is going to happen that week of Blueberry Festival as well. Larissa Philpott in Economic Development. She is championing for these restaurants that, saw a decline in their ability to do business during the pandemic and trying to give them an injection and influx of business there, along with Ryan Russell at the Fredonia. So those are the great minds and the power behind that great event. So I encourage you to get out and get involved and make this week a great week.
That's a great challenge, Sherry. Thank you. And I appreciate you mentioning Mary's chat comment. Please either consider that for yourself or someone you know that could be part of the tastiest festival in Texas. Did anyone have any questions for Ms. Morgan? All right, well, moving on. We're glad to have back to the call Anita Scott, the Center Director at our county's Exposition and Civic Center. Anita, are you there?
Good morning, everyone. Good morning from the northwest side of Nacogdoches. Yeah, Kelly, I heard you kind of stumble on the exposition. Try saying that when you answer the phone. It's a mouthful. So I want to start by giving a brief update on what we've been doing here at the Expo Center. A couple of weeks ago, we had on April the 24th, the Nacogdoches Rotary Club hosted the Old Stone Fort bike ride, and Mr. Ray Mitchell reported that he had over 200 bike riders. So that was a very successful event. If you see Mr. Ray Mitchell, please congratulate them on a very successful event. Also, on that same evening, we had the, are y'all still there?
Yes, we're here.
Okay, I'm sorry. I'm getting a phone call too. So I put it on do not disturb, but some reason it's still coming through. Anyway, on the same evening, we had BY's Entertainment Group hosted a music concert with Parker McCollum, and we had over 4,000 concert goers here in attendance at the Expo Center. So we've been very, very busy. The very next weekend, which was last weekend, we helped the JCs host their Red Dirt Mud Run event. I don't know what their attendance was, but I know that they do a very good job on their event, so I'm assuming that it was a great turnout for them as well. As we move forward, tomorrow, May the 5th, we will have the COVID vaccination clinic. I believe that will be one of our, like the 12th event clinic that we've had here at the Expo Center. And we'll have more throughout the month of May. I think May the 22nd, we'll have another one. And then again, May 26th, that one hadn't been confirmed yet, but I believe that we will have another one on that date as well. On May 13th, the Nacogdoches Sheriff's Department, Sheriff Bridges, will host the Fallen Peace Officers Memorial here at the Expo Center. The gates or the doors are open at 10 a.m. and that's open to the public. We want to invite you to please come and show your support for those families who've lost their loved ones in the line of duty. On May the 20th through the 23rd, Evans United Spring Carnival will be here on our midway, and they will be here starting again May the 20th, and the admission is free to get in. We don't have the ride specials yet, but that will be announced on our Facebook page and also on our website. We are working with Trina Menifee with the Nacogdoches Band Boosters. They will host their awards banquet here at the Expo Center on May 24th. That's a Monday evening. And they plan to have a carnival themed event as well. So we're excited to work with them and see how their little event's going to turn out. It's going to be great. We're excited about it. And on June the 4th and the 5th, we're working with Jake and Miriam Mum with Rose Lake Ranch. If y'all remember, back in March, they hosted the Drill in the Pines. That's an equestrian drill competition. And this time it's going to be Thrill of the Drill is the name of their event. And if y'all remember, they filled the hotels. So that's going to be a big event, and we're excited about that. On June the 12th, I know y'all mentioned the Blueberry Festival, and so we will be hosting the Cody Johnson concert here at the Expo Center on that night. So be sure to get your tickets. We have a link on our website. That's the Nacogdoches County Exposition and Civic Center's website. It's a link that will take you directly to the website to purchase your tickets. We want to encourage you not to go to other third-party concert ticket buyers to buy your tickets, because you might pay more than what you have to pay if you don't go through the right channels. And we are also working with Craig White with the National Wild Turkey Federation Banquet to host their event here at the Expo Center on June the 18th. And then I know I'm going far into June, but I need y'all to know what's going on. So that way, if you want to be a part of it, you can be sure to get in touch with us. June the 26th and 27th, the gun show, the GNS Gun Show will host their event here. And on the same Saturday, we will have the Piney Woods Livestock Validation in Barn 3 at 6 a.m., between 6 a.m. and 9 a.m. And then on that same day upstairs, we are working with the Smith Sawmill Services to have an event upstairs. So we'll be very busy in June, as you can see. If you want to know more information about events happening here at the Expo, you can go to the NAC Expo website. We keep up with our events on that and also on our Facebook page. So again, that's a lot going on. If you have any questions, please give us a call. We're here Monday through Friday from 8 to 5. And our phone number here at the office is 936-564-0849. That's all I've got.
Well, thank you, Anita. Did anyone have any questions for Anita right now? I also want to mention she does have great facilities for hosting your private events too. So check with her if you're ever looking for meeting space or party space for your own parties.
That's right. That's right, Kelly. During the week, we have a special rate upstairs. If it's 50 or less, we do all the cleanup, all of the setup and everything upstairs. If you're looking for an event or place to host a meeting or such, give us a call here at the Expo Center. We'll be glad to give you some pricing on that as well.
Well, thank you.
Thank
that
you.
That cleanup is a big plus. Love that.
Yes, it is. And it also comes with the projectors. So if you are having a slide presentation or whatnot, it comes with all of that. It comes with the kitchen. And so it's a good place to have a meeting such as that.
Great. Well, thank you, Anita. We appreciate the information.
Certainly. Thank you for having me.
We're going to move on to the president and CEO of our Nacogdoches Area United Way, Mr. Gary Lee Ashcraft.
Kelly. I think he might have been having some technical difficulties, and he asked me to share a little bit about what's going on with United Way. Last week at our board meeting, we kicked off our 2022 campaign, and it's a little bit early, but our campaign is focused on Brighter Days Are Here. And last year it was Better Days Are Ahead. And so we're kind of focusing on how things are brighter now and how they're, we're working for brighter days for our community. And we'll be working on a small business campaign called Small Business Circle 365, where we can recruit small businesses to contribute to the campaign for the low price of $365. So $1 a day gets you in the small business circle for United Way. And we'll be kind of pushing that out soon. And anybody that wants more information on that can let me know or visit with Gary Lee at the United Way. But lots going on. We have our Day of Caring come up in June, where United Way organizes an event for our companies to go out and give back in a way of sweat equity and helping those agencies, our partner agencies, with little projects. Sometimes it's gardening or painting or just cleaning up different areas, putting together benches and picnic tables and things like that. So it's really a fun day of partnership, and that will be in June on that Friday, the 18th, I think. It's the Friday after Blueberry weekend.
Thank you, Kenny. That was Kenny Rena. She is an employee at Burke, but she also is the past chair of the United Way, our Nacogdoches chapter, and she has another hat she wears. And since she's on the call, I would love for her to talk about the new things she's bringing to the Texas Blueberry Festival through running of the blueberries. Kenny, can you give us just a brief note on what you've got planned?
Yes, I can. I'm excited. So the running of the blueberries has been a 5K for the last 9 years. Last year we had a virtual event and we had 78 people participate in that. And this year we're having our live event again, and we're excited. So it's our 10th annual running of the blueberries. We're also adding a 10K to that event. So for an extra challenge for some participants. And we already have people, I think we have 10Kers signed up right now, and about 60 total for the event. The other event that we're offering this year, in addition to the 5K, is a 1 mile, and it's a friendly, gentle course is what we're calling it. It's around the softball, not the softball fields. We started the softball fields, but the Dempsey soccer fields is where we'll have the 1 mile, and it kind of goes around that. Good for doggies, with little feet that aren't runners and that sort of thing. The other thing is our event's sponsored by Pilgrims, and we do have a virtual option available, so you can register for that. Let's see what else. We're working on lots of fun details for after the event. Maybe different kinds of, entertainment or snacks and fun things like that before they get on over to the Blueberry Festival and have some pancakes.
Thank you. Thanks for all the contributions that you're making in our community. And I did get a text message. There might have been some weather issues causing technical difficulties. We might have lost some of our later report givers. But is Jessica Sal? I do see Jessica there. She is with the Communications and City of Nacogdoches and Main Street Director, Historic Sites, just all kinds of good stuff. Hi, Jessica.
Hi. Yeah, I wear a lot of different hats, but today's just COVID stuff. And of course, with Anita on here, I think she's covered the major COVID updates that we have as far as, the city and county are kind of moving away from these mass vaccination clinics. That being said, we do have another one coming up. Our next clinic is Wednesday, May 5th. So tomorrow we still have appointments available. We have Moderna shots and the Johnson & Johnson, since the FDA has cleared those, and we should be good to go. And so you get your appointment by calling our call center, which is 936-305-8488, or going to our website, which is tinyurl.com/vacnac. So that's all I have for today.
Well, thank you. If anyone has any questions for Jessica, I'll also mention that it looks like our last caller might not be able to join us because, or report giver, because of the issues. And if anybody had a closing comment or special announcement, this is your chance. And I'm hoping we might hear a final word from our president and CEO of the Nacogdoches County Chamber. If Mr. Mitchell can jump back on, there he is. Would you like to say something to the group before we sign off?
Well, first of all, I missed you folks. It was not the vacation I had planned, but with all kidding aside, the great folks at Houston Methodist and St. Luke's in Lufkin did a great job in patching me up and getting me back here. And I can't tell you how much I missed all of you folks. And I want to acknowledge my staff, which is on this call, and the great job they did in my absence. I was not surprised. It appears that things went very smoothly, and I'm proud of all of you folks. And I'm equally proud to get back to my adopted hometown here in Nacogdoches. Just one thing I want to mention, Kelly, is that the Chamber is sending a delegation tomorrow down to Austin to share the Chamber's priority legislative issues with those issues that remain to be resolved by the Texas legislature. And if anybody has any suggestions or input, I would respectfully suggest you give Kelly a call today so that she can share that message with the delegation going down. My work plans are this: I plan to at least be back half days next week and then full time after that, but I will be available on my cell phone if anybody has any questions and whatnot. And again, thanks to everybody for all the hard work they're doing. We should be proud of Nacogdoches and the great things that are going on here. It's yours, Kelly.
Well, thank you guys. Thank you everyone who's managed to stay with us. I'm going to stop the recording, but the information in the chat section will be left up for a few moments if you needed to copy and paste.